All right, welcome back to The Explainer. Today we're going to dive into a part of our anatomy that's, well, it's absolutely essential, but it pretty much never gets the spotlight. And trust me, its story is way more interesting than you'd probably guess. We're going to kick things off with a bit of a strange riddle.
So, let me ask you this. What in the world could a simple bicycle possibly have in common with a super high-performance Ferrari? And no, the answer isn't in a garage or out on a racetrack. Believe it or not, the answer is a surprising lesson in anatomy, specifically urethral anatomy. And I promise, by the end of this, you are going to know exactly what I'm talking about.
So here's our game plan. We'll start with the unsung anatomy, then create a urethral roadmap. After that, we'll finally get to the bottom of bicycles versus Ferraris, look at what happens beyond the crash, and finish up with the final takeaway.
All right, let's jump right in. Section 1, the unsung anatomy. It's time to get to know this really crucial piece of our, let's call it internal plumbing.
Okay, so the first thing you need to know is that its length, it's incredibly variable. I mean, our source material actually gives this amazing and, very technical scale. It ranges from itty-bitty all the way up to Lionheart-sized. It's just a really memorable way of saying, yeah, one size definitely does not fit all here.
Okay, so now let's build on that. We're going to create a full anatomical roadmap. Think of this next part as like a guided tour, where we'll point out all the key landmarks you gotta know. So, at its most basic, you can think of the urethra in two main parts, the anterior and the posterior, right? The anterior part includes the penile and bulbar sections, and then the posterior is made up of the membranous and prostatic sections. Now, you're going to want to remember that division because it is going to be super important in just a minute.
So our source points out a few things it calls testable trivia. These are the key landmarks with some kind of fancy names. You've got the fossa navicularis, way up at the front, then the verumontanum, which is deep inside the prostatic urethra. And finally, there's the cone, which is a really critical junction point.
Let's actually zoom in on that verumontanum for a second. It's this kind of ovoid mound. But here's the really cool part. Right in the middle of it is something called the prostatic utricle. And get this. It's an embryological remnant from our earliest development. It's like a little piece of our own history, just sitting right there.
Okay, it is time to connect the dots. Section 3, bicycles versus Ferraris. This is where we get to see how that whole anatomical roadmap we just made actually applies to real-world trauma.
So let's start with the first scenario, which is also the much more common one, the straddle injury. Yeah, you can probably already guess where this is going.
Yep, the classic example. Crashing your bicycle or tricycle and landing on that crossbar. It's a perfect and probably very painful illustration of this exact type of trauma.
And this just brilliantly illustrates the mechanics of it all. What happens is the force crushes the anterior urethra, that front part we talked about, specifically the bulbar portion, right up against the pubic bone. So your bicycle crash is an injury to the front part of the urethra. And it's actually the most common cause of a traumatic narrowing, which is called a stricture.
Okay, now for our second scenario. And this one is a lot more severe. We're talking about the pelvic fracture injury. And what's the classic cause here? Well, it's a massive high-impact event, like crashing your Ferrari. I mean, the forces involved are just on a totally different level. So unlike that bicycle injury, a Ferrari crash affects the posterior urethra, the back part. This means the injury is way deeper inside the body, and it's almost always part of a much bigger, more serious trauma. We're talking pelvic fractures, and a lot of times bladder injuries too. Doctors actually have a formal system for classifying all these injuries. If you look at this table, you'll see that types 1, 2, and 3, those all have to do with those posterior Ferrari-style injuries, just with different levels of severity. And then look all the way down at the bottom. Type 5, that's our anterior bicycle straddle injury. You can really see how the anatomy we talked about directly informs the diagnosis. Of course, it's not all about trauma. Let's take a quick look at some of the other conditions that can affect the urethra.
So aside from a big injury, those strictures, the narrowing, can also happen from something like long-term catheter use. Then there's something called a diverticulum, which is like a little pouch that forms, usually from repeated infections. You can also see injuries from stuff like radiation therapy for cancer. And while tumors are pretty rare, when they do happen, it's almost always a specific kind called squamous cell carcinoma.
All right, let's bring this all home. Why does any of this matter? Why is it important to understand this unsung piece of anatomy?
The big takeaway really is this.
Once you know the roadmap, from the verumontanum all the way to the cone, and once you get how the front part is vulnerable to a bicycle crash and the back part is vulnerable to a Ferrari crash, it completely demystifies this part of the body. It takes this abstract anatomy and connects it directly to real-world consequences.
And this is seriously practical stuff. Our source gives this great clinical pearl. If a doctor sees blood at the opening of the urethra after some kind of trauma, the absolute next step is to get a special X-ray called a retrograde urethrogram, or a RUG. This kind of knowledge literally guides life-saving medical decisions in the moment.
Which, of course, leaves us with one final and I'd say very important question from the source material. With a unicycle, there's no crossbar. So what kind of injuries are associated with a unicycle wreck? The source suggests it might involve things like juggling and sword swallowing, but I'll just leave that one for you to think about.
Hey, thanks for joining us for this explainer. As always, keep asking questions and we will see you next time.